G'day folks, Dr. Ethan Walker here. I've been practicing urology for over 35 years now, and if there's one question that blokes are too embarrassed to ask in my clinic but desperately want to know the answer to, it's this. What happens to your prostate if you're having a solo session every day? Right, let's cut through the BS straight away. I'm not going to make you sit through 20 minutes of waffle before answering the bloody question. Here's the truth. Regular ejaculation, whether through masturbation or partnered sex, is actually beneficial for your prostate health. Yeah, you heard that right. Studies have shown that men who ejaculate more frequently have a lower risk of prostate cancer. In fact, research from Harvard Medical School found that blokes who ejaculated 21 times or more per month had about a 20% lower risk of prostate cancer compared to those who did it 4 to 7 times monthly. So if you've been feeling guilty about your daily routine, you can relax, mate. Your prostate actually appreciates the workout. Now, why is this? Well, regular ejaculation helps flush out potentially harmful substances from the prostate gland. Think of it like cleaning out the plumbing. When prostatic fluid sits around too long, it can concentrate toxins and inflammatory compounds. Regular flushing keeps things fresh and reduces the buildup of cellular debris that might contribute to cancer development. It's nature's way of keeping the system maintained. But here's the thing, and this is where I need your full attention. While your masturbation habits aren't harming your prostate, there are 10 other lifestyle factors that absolutely are destroying it, and most blokes over 60 are doing at least half of them without even realizing. I see it in my clinic every single day. Men coming in with enlarged prostates, difficulty urinating, getting up 4 or 5 times a night to pee, and when I ask about their daily habits, I can tick off the problematic behaviors like a bloody checklist. So let me walk you through what's really happening to your prostate, and more importantly, what you can do about it before it's too late. First up, and this is the big one, sitting on your backside all day. I call it the tyranny of the chair. You might think I'm exaggerating, but prolonged sitting is one of the worst things you can do for your prostate health. When you're sitting, especially for hours at a time, you're putting constant pressure on your perineum, that area between your scrotum and anus. This pressure compresses the vital blood vessels that supply your prostate with oxygen and nutrient-rich blood. Without adequate blood flow, the prostate tissue becomes starved and inflamed. It's like putting a tourniquet on any other part of your body. The tissue suffers. Blokes who work desk jobs or spend their retirement watching telly all day are at significantly higher risk of benign prostatic hyperplasia, that's BPH, and enlarged prostate. I've had truckers in my office, security guards, office workers, all with the same bloody problem. They're sitting 8, 10, 12 hours a day, and their prostates are paying the price. The inflammation becomes chronic, the gland swells, and before you know it, they're struggling to get a decent stream going when they need a slash. The solution? Get up and move every 30 to 40 minutes. I don't care if it's just walking to the kitchen to put the kettle on or doing a lap around the office. Your prostate needs circulation. Think of it as an investment in your future quality of life. Because trust me, when you can't sleep through the night without getting up to pee 3 times, you'll wish you'd taken this advice seriously. Second, and this ties directly into the first point, lack of physical activity. Your pelvic floor muscles are crucial for prostate health, but most blokes don't even know they exist until something goes wrong. These muscles support your bladder and bowel, and they help control urination. When they're strong and toned, they assist with urine flow and ensure complete, efficient bladder emptying. But when they're weak from lack of use, everything goes to pot. Regular exercise, particularly activities that engage your core and pelvic region, keeps these muscles strong. I'm talking about walking, swimming, cycling in moderation, and yes, even specific pelvic floor exercises. You might think Kegels are just for Sheilas, but blokes benefit enormously from them. Strengthening your pelvic floor can improve urinary control, enhance sexual function, and support overall prostate health. The research backs this up. Studies have shown that men who maintain regular physical activity have lower rates of prostate problems. Exercise reduces inflammation throughout the body, improves circulation, helps maintain a healthy weight, and regulates hormone levels. All of these factors directly impact prostate health. So if you're spending your days parked in front of the telly with a meat pie and a beer, you're setting yourself up for trouble down the track. Third on the list, your diet. And look, I get it. We're Aussies. We love our Barbies, our beers, our processed snacks. But the modern Western diet is absolutely shocking for prostate health. I'm talking about all those processed foods, red meat consumed in excess, refined sugars, trans fats. These foods promote inflammation throughout your body, and your prostate is particularly vulnerable. Chronic inflammation is like a slow-burning fire inside your prostate gland. Over time, this inflammatory process can lead to cellular changes, tissue damage, and yes, an increased risk of both BPH and prostate cancer. Every time you reach for that processed meat pie or those chips, you're adding fuel to that fire. What should you be eating instead? Focus on anti-inflammatory foods. I'm talking about tomatoes, which are rich in lycopene, a powerful antioxidant that's been shown to protect prostate cells. Load up on cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts. Yeah, I know. They're not as exciting as a sausage sizzle, but they contain compounds that help regulate hormones and reduce cancer risk. Fatty fish like salmon and sardines provide omega-3 fatty acids that fight inflammation. Nuts and seeds, particularly Brazil nuts and pumpkin seeds, are excellent for prostate health. And don't forget about green tea, which has been used in Asian cultures for centuries and contains catechins that protect prostate tissue. The fourth factor, and this one's often overlooked, chronic stress. Now, I know what you're thinking. Stress affects your heart, your blood pressure, sure. But your prostate? Absolutely. When you're constantly stressed, your body produces elevated levels of cortisol and adrenaline. These stress hormones create a cascade of physiological changes, including increased inflammation and altered hormone production. Your prostate is particularly sensitive to hormonal fluctuations. Chronic stress can lead to elevated levels of dihydrotestosterone, or DHT, which is one of the primary drivers of prostate enlargement. It's like pouring petrol on a fire. I've seen blokes in high-stress jobs develop prostate problems at younger ages than those in more relaxed professions. The mind-body connection is real, folks. What can you do about it? Find ways to manage your stress. Whether it's meditation, fishing, gardening, spending time with your grandkids, whatever helps you unwind. Regular exercise also helps reduce stress hormones. Some blokes find that yoga or Tai Chi are particularly beneficial because they combine physical movement with mindfulness. The point is, you need to actively work on stress reduction. It's not optional if you want to maintain good prostate health. Fifth, dehydration. I see this one constantly, especially with older blokes who've got this backwards idea that drinking less will mean fewer trips to the loo. Wrong, dead wrong. When you don't drink enough water, your urine becomes concentrated with minerals and toxins. This concentrated urine irritates the bladder and urethra and can contribute to urinary tract infections, kidney stones, and prostate inflammation. You need adequate hydration to keep your urinary system functioning properly. The key is timing. Drink plenty of fluids throughout the day, but taper off a few hours before bed to minimize nighttime bathroom trips. And I'm talking about water, not beer or soft drink. Those sugary and alcoholic beverages can actually irritate your bladder and make things worse. Number 6, alcohol consumption. Now, I'm not telling you to go completely teetotal, but excessive alcohol intake is problematic for your prostate. Alcohol is a diuretic, meaning it increases urine production, which can exacerbate urinary symptoms if you already have prostate issues. More importantly, alcohol can irritate the bladder and prostate, increase inflammation, and disrupt hormone balance. I've had patients tell me they're having 4 or 5 beers every evening, wondering why they're up all night needing a slash. The connection seems obvious to me, but many blokes don't make it. If you're going to drink, do it in moderation. The Australian guidelines suggest no more than 10 standard drinks per week, and no more than 4 on any single day. And honestly, for optimal prostate health, even less is better. 7th, and this might surprise some of you, holding in your urine for extended periods. I get it, sometimes you're stuck in traffic, in a meeting, or just can't be bothered getting up. But regularly ignoring the urge to urinate can weaken your bladder muscles over time and put extra strain on your prostate. It can also increase the risk of urinary tract infections and bladder stones. When your bladder is constantly overfilled, it stretches beyond its normal capacity. This chronic overstretching weakens the bladder wall and can lead to incomplete emptying. Residual urine sitting in your bladder becomes a breeding ground for bacteria and can contribute to chronic infections that inflame the prostate. Listen to your body. When you need to go, go. Don't put it off. 8th, smoking. If you're still smoking in this day and age, well, you're not doing yourself any favors in any department, but particularly not your prostate. Smoking introduces thousands of toxic chemicals into your bloodstream. These toxins increase inflammation throughout your body, damage blood vessels, reduce oxygen delivery to tissues, and have been linked to more aggressive forms of prostate cancer. I've had patients who survived prostate cancer only to develop recurrence or more aggressive disease, and smoking was a common factor. The good news is, if you quit, your body starts repairing itself almost immediately. Even if you've smoked for decades, quitting now will benefit your prostate health. It's never too late. 9th, ignoring symptoms. This one drives me absolutely mental. Blokes will notice changes in their urination, difficulty starting the stream, weak flow, frequent nighttime urination, and they'll just put up with it for months or even years before seeing a doctor. Mate, early detection and intervention are crucial for prostate health. If you notice any changes, get checked out. A simple prostate exam and PSA blood test can provide valuable information. Many prostate problems are easily manageable if caught early, but if you wait until things are severely impaired, your treatment options become more limited and invasive. Don't be a gala about this. Your health is worth a slightly uncomfortable doctor's visit. And finally, number 10, excess body weight, particularly abdominal obesity. Carrying extra weight, especially around your midsection, isn't just bad for your heart and joints. It's terrible for your prostate. Visceral fat, that deep belly fat, is metabolically active. It produces inflammatory compounds and hormones that directly affect your prostate. Studies have shown that obese men have higher rates of prostate enlargement and more aggressive prostate cancers. The mechanisms are complex, involving hormone imbalances, chronic inflammation, and insulin resistance. But the bottom line is clear. Maintaining a healthy weight is crucial for prostate health. I'm not saying you need to look like you did at 25, but keeping your weight within a reasonable range through diet and exercise will pay dividends for your prostate and your overall health. Even modest weight loss can make a significant difference. So, there you have it, folks. Those are the 10 lifestyle factors that are slowly destroying your prostate. And here's the critical question. Now that you know, what are you going to do about it? Because knowledge without action is useless. Let me tell you about a patient I saw just last month. 72-year-old bloke, retired public servant, came into my office barely able to urinate, getting up 6 or 7 times every night, absolutely exhausted and miserable. When I reviewed his lifestyle, he was ticking nearly every box on this list. Sedentary, poor diet, overweight, stressed about his declining health, the whole catastrophe. We didn't just treat his symptoms, we addressed the underlying causes. He started a walking program, cleaned up his diet, learned stress management techniques, lost some weight. 3 months later, he was like a different person. Sleeping through most nights, better urinary flow, more energy. He told me he felt 20 years younger. That's the power of lifestyle changes, mates. Now, I want to be clear about something. If you're experiencing significant prostate symptoms, these lifestyle changes should complement, not replace, proper medical treatment. Some blokes need medication, some need procedures. There's no shame in that. But even with medical treatment, addressing these lifestyle factors will improve your outcomes and quality of life. Your prostate doesn't exist in isolation. It's part of your entire body system. When you take care of your overall health through proper nutrition, regular exercise, stress management, and avoiding harmful habits, your prostate benefits along with everything else. I've been doing this for over 35 years, and I can tell you with absolute certainty that the blokes who maintain good lifestyle habits have far fewer prostate problems. It's not rocket science. It's just consistent, sensible self-care. So here's my challenge to you. Pick 3 things from this list that you know you need to work on. Don't try to change everything at once because that's overwhelming and you won't stick with it. Choose 3, commit to them for the next month, and then add more changes as those become habits. Maybe you commit to getting up and moving every 30 minutes during the day. Maybe you cut back on the grog and processed foods. Maybe you start doing pelvic floor exercises while you're watching the evening news. Whatever you choose, make it realistic and sustainable. And remember, taking care of your prostate is taking care of your quality of life. The ability to sleep through the night without bathroom trips, to have normal sexual function, to not worry about whether there's a toilet nearby wherever you go, these aren't small things. They're fundamental to your independence and dignity as you age. It's not too late to rewrite your prostate health story. Whether you're 60, 70, 80, or beyond, your body can still respond positively to better choices. I've seen it happen countless times in my practice. So that's it, folks. You now know the truth about masturbation and prostate health. You're not doing any harm there. Quite the opposite, actually. And you know the 10 lifestyle factors that are the real culprits behind prostate problems. The question is, what are you going to do with this information? Your prostate health is in your hands. Make the smart choices. Your future self will thank you for it. Until next time, take care of yourselves and don't be a stranger to your doctor. Cheers.